Hello, and we are live. Welcome to the webinar of 10 most asked questions about dental veneers. And why did I decide to do this? Why is it that it's important for you to know? Well, because if you're looking for veneers, more than likely you have a lot of questions. If you have a lot of questions, well, why not ask the person who does them? So here I am, Dr. Spinati. I am from Spinati Dentistry, and today we're going to be talking about the 10 most asked questions about dental veneers. What you wanted to know, but were too afraid to ask. So if you're looking for results like this, where you see the before and afters on the left side and on the right side, or like this, then this one is for you. Because I've gathered the 10 most asked questions or 10 most on top of mind of people that actually want to get veneers. And so I'm here to enlighten you on what it is that people ask. And so let's get started. The first question is, how long do teeth veneers last? Well, teeth veneers or dental veneers, they last, according to studies, between 16 to 20 years. Now, I do want to stress that the first veneer was actually put on in California in 1928. And so it's been almost 100 years since these veneers have been put on, and millions of people have gotten them, millions. And everyone that gets them loves them. And the reason why they love them is because it increases their confidence. I mean, that's the whole reason of doing veneers, is that to make your appearance more beautiful or more handsome. And so there are some factors, because more than likely you're going to be asking, well, what is failure? Like, why is it that it only lasts 16 to 20 years? What determines it to be actually fail? And so I put that on the slide. And so you'll see here, and this is according to a study. Okay, so failed veneers were associated with aesthetics. Aesthetics just means that they just don't look good anymore. Either, more than likely in this study, more than likely what they're talking about is the gums have receded. So that now you can see the margin, you can see where the veneer is and where the tooth starts. And so if that's the case, then that's a failure. That's considered a failure. Still good, still, still functions well. There's no chips, there's no cracks, and 31%. But because it doesn't look as good, and I've had a lot of these situations where patients have had veneers for 15, 20 years or even longer. And now they're starting to see the roots. The roots are starting to show, or they're starting to not like the appearance of it, or they just want to get a refresher. I've had a lot of these types of patients where they just want to get it redone. There's nothing wrong with the veneers themselves, but that's the situation. Another situation is mechanical complications. So, mechanical complications in veneers would be like, your bite's not proper. Okay, that's the only mechanical complication that I can think of, to be quite honest with you. Any other mechanical complication with veneers I can't really think of, or maybe you're starting to develop crowding around it. Whatever it is, that's mechanical complications. Periodontal support. So you're starting to lose bone support, you're starting losing gum support. So I guess that goes along with the aesthetics. The aesthetics probably the 31%. I didn't read the study in detail, but the aesthetics is probably just because you just don't like the way it looks. And I've had a few patients like that too. Or loss of retention. So, very few of them, whereas the veneer actually came out. Okay. Caries, so decay. So yeah, people actually had cavities. It's interesting to note, actually, that only 6% out of the entire population they studied 100 of these people that had veneers, only 6 of them actually got their veneers redone, or they experienced a quote unquote failure because they had decay. They had cavities, only 6. Or tooth fracture. So when people think that, okay, well, if I put a veneer, it's going to fracture, or if I put a veneer, we're going to have cavities or whatever, that's not the case, as you saw in the study. And that's a 16-year study where they actually looked at all these people that had veneers, and they determined that the majority of them lasted for 16 years. And the point where it failed is those. Okay, and you can see the majority of them is the aesthetics, where people actually just didn't like the way they looked anymore after 16 years, and so they just wanted to get them replaced. That's question 1. Question 2, what happens to teeth under the veneers? Now, this is a very good question, because obviously you don't know. Now, the thing is with veneers, the difference between veneers and a crown, veneers is a one-surface application, whereas a crown is a multi-surface application, so you're covering the entire tooth. So what happens under the tooth of a veneer Barely anything, because if you're removing a very tiny amount of tooth structure, then literally the remainder of the tooth structure is still there. Around 90% of the tooth structure is still there. And so only a little part of it is actually removed. So to answer your question more detailed, you can see here in this picture on the slide, you can see where you can see a little bit of the tooth structure has actually been removed. And you can see on the right side where you can see the veneer is see-through. And the reason why it's see-through is because only a little bit of the tooth structure is actually removed. And I have to emphasize that this has been done for almost 100 years. So it's not like it just came on yesterday, like certain products. So it's not like that at all. It's been there. It's the techniques have been improved. You know, the lab techniques have been improved. The clinicians' techniques have been improved. A lot of studies have been put into it. So it is a very tried and true type of cosmetic procedure. Now, how much do veneers cost? Now, this is probably one of the most asked questions about anything, really. How much does anything cost? Now, I can tell you that they range. They range between $1,800 a tooth, not the whole thing, $1,800 a tooth to $4,000 a tooth. And some even charge a lot more. You know, if you go to the States, you see some people, they charge a lot more than that. And this is in Canadian dollars. But in American dollars, some charge even more than that. So just keep in mind that they are expensive. Now, here's the thing, and I put this on the slide. And I said this before, that veneers, because they're a cosmetic procedure, they're not meant to be cheap. They're not supposed to be cheap. If I'm looking for something to enhance the way that I look, I don't want it to be cheap. You know, as much as I'd love to not pay a lot for any kind of work, I want it to be done right. I want it to be done well. And so obviously I'm going to seek a highly experienced person, someone who's done it many times before. I'm going to seek for that. And obviously I'm going to have to be prepared to pay. And the reason why is because, and as I put there, is because veneers, they last you, yes, they last you 16 to 20 years, sometimes even more. I've had patients that have had them for 25 years. Now, the reason why they're expensive is because they last you for that long. Now, here's the thing that you're probably not thinking about is that veneers, you're actually using them 24/7. You sleep with them, you wake up with them, you eat with them, you smile with them, you travel with them. It's the exact opposite of something expensive, such as maybe, I don't know, your house, right? Your house, you only use it a certain amount of time, right? The majority of time that you're spending outside of your house, right? When you're working. But the house costs a lot of money. Same thing with your car. Your car, you're only driving it from A to B. There's only a certain amount of time that you're actually using it. You're not using it when you're sleeping. You're not using it when you wake up. You're not using it. You're using it to drive from place to place. So whereas your teeth, you're using it all over the place. So in comparison, in terms of usage and cost, if you're to compare usage and cost, you're going to see that actually veneers are an incredible investment for the amount of things that it gives you in return, which is confidence, which is the ability to smile without covering your mouth, which is the ability to project yourself and to be yourself. I've seen people transform drastically when they put veneers on, drastically. They've changed. Like, I'm not joking you, and I hear this over and over again. I should maybe make it into a huge poster and saying, I didn't used to smile, and now all I can do is smile. Literally, that's all I hear consistently. Every single time I do, I put on veneers on a patient, that is what I hear. So to answer that question, which I think is a very valid question, it's a very valid question, but I think perspective is due, and that you are using them, they do last you a very long time, and you use them consistently. Okay, so is veneer good for your teeth? That's actually a question. I didn't alter the questions. These are the questions that I actually asked. Is veneer good for your teeth? Well, a good answer to that is that veneers aren't good or bad for your teeth, depending on who does it, of course, but they're not good or bad because the whole reason of doing them is for cosmetic reasons. There's really no other reason that I can think of as to why someone would get a veneer. A crown, different situation. But veneer, it's purely a cosmetic procedure. Purely. Unless there's someone in here in the chat that wants to tell me why they would get veneers that is not for cosmetic reasons. But more than likely, I mean, I'll tell you right now, it's purely cosmetic. So there is no good or bad. It's just it is what it is. It's like, if I'm getting a facelift, maybe I'm due for it soon. If I'm getting a facelift, by the way, I'd never do a facelift. But if I'm getting a facelift, then is it good or bad? It's not good or bad. It's a cosmetic procedure. I'm, doing some lip fillers. Now that's something I should probably do. If I'm doing some lip fillers, is it good or bad? It's a cosmetic procedure, right? So it's not good or bad. Okay, so I think that question is misplaced. Okay, but it is to enhance your appearance, increase your confidence, make you look and feel your best in pictures, videos, and in social gatherings. All right, can you go back to normal teeth after veneers? Now, any kind of cosmetics, whether it's bonding or porcelain, once you get it, it is a commitment. It is something that you have to deal with for the rest of your life. Okay, it's a commitment, but it's something that is going to give you a lot in return. That's why we call it an investment, because anything that you invest, whether in monetary means, or let's say your brain, or whatever it is that you're going to invest in, it's going to give you a return on that investment. And the return on the investment is umpteen. I mean, have you seen someone walk around with a nice smile versus someone that walks around with not such a nice smile? Need I say more? The person with a nice smile automatically exudes confidence. Automatically, like, the people who are seeing them, they see them as someone who is, higher in prestige, higher in wealth, even though they may not have those things, but they project that image. And that's the whole point of doing veneers. It projects a different type of image. And so that's why it's called cosmetics, right? And so with that kind of image, obviously now you have a higher confidence. With higher confidence, you can do a lot more with your, I mean, if you meet someone that has a lot of confidence and someone that doesn't have a lot of confidence, that's someone that has confidence is unstoppable. They can literally do whatever, right? Because they have a lot of confidence. They can do whatever, they can say whatever, and the majority of it is good because they're confident, right? Their life is great. If you pass through life and you're confident, your life is amazing. But if you pass through life, you're not confident, your life's not that good because you're not confident, right? You're second guessing yourself. You're doubting yourself. You're always looking to see from other people's, you want other people's approval, right? So I'm not talking about psychology right here, but it has to do with a lot of that stuff. Okay, but that's what it is. So can you go back to normal teeth after veneers? No. Whether you do porcelain veneers, whether you do bonding, as soon as you get anything done to your teeth, it's a commitment. It's a commitment for life. Okay, why not get veneers? That's a great question. So why should you not get veneers? So if you're thinking about, you're like, okay, should I get veneers? Should I not get veneers? If you're on the fence, here's something that's going to tip you away from it. If you have very large fillings on the front, then veneers is probably not a good option for you. You probably have to seek other options. Another option would probably be for you crowns. Okay, so but that in that situation, it would be a cosmetic and a restorative procedure. It would be something that would, it would strengthen the integrity of your tooth, because eventually those fillings are going to have to be replaced. They're going to get bigger, and so in order for you to end that cycle, you put a crown on. Okay, so now if you are, for instance, if you have something called hypomineralization, okay, where your enamel has basically, like, you're born with not enough enamel. So if you're born with not enough enamel and you want to put veneers on, it's probably not a good choice, okay, because you want something to bond to, and that bond strength is probably very low. So that's another reason why. If you have a root canal treated tooth, veneers is not a good option for you. A crown would be a good option for you. What else did I put there? If you're not certain about how you want your teeth to look, if you're not certain about actually getting veneers, don't until you're certain, right? If you're sitting on the fence, you're like, I don't know if I want veneers, but I want to do them just because my friends did them. Don't do that. Okay. Be certain about what you want. Go to the dentist with, several pictures. When I do consultations, or when my manager does consultations, we ask for a lot of photos as to what you want your teeth to look like. Because if you want your teeth to look a certain shade or a certain thing, and you're starting with a very dark shade, then that tells us a lot about how much work we have to do, how much planning we have. It all comes into the planning. So, and we have to set expectations, a lot of people want very natural teeth, but they want them white, right? Well, how white? How natural, right? Because I can make something look very natural, but you may not like it. I may like it. You may not like it. So If you're not sure about how your teeth are going to look or how you want them to look, then don't do it. And one of the things that I put on there as well as to why you shouldn't get veneers is if your teeth are not straight. If your teeth are not straight, your bite's off, the chances of you actually doing veneers without doing harm to your teeth is slim to none. Because if your teeth are crooked and you're trying to straighten them with veneers, well, the dentist is going to have to more than likely do crown type of work. It won't be a veneer type of work. So then now you're actually removing not just 10%, not just 15% of your tooth structure. Now you're removing around 50% of your tooth structure. You're removing a lot of the tooth structure in order for it to appear straight, which is a very bad option because now at this point, your roots are going to be in many different directions. So now it's a bad choice. So if your teeth are not aligned, I don't treat anybody if their teeth are not aligned. If your bite's not aligned, and I know that if I put veneers on, they're just going to chip because of the way that your bite is, because of the way that your teeth are meeting together, I won't do it because it's going to be a nightmare for you and it's going to be a nightmare for me because you're going to have to come back and you're going to say, well, look, like, it's not lasting. It keeps chipping. Well, I mean, the reason is it's my fault. I mean, I'm the one that did it without telling you that you shouldn't do it. So I refuse. And I've refused some of the patients who have come to me and they didn't want to do, Invisalign, or they didn't want to be referred to an orthodontist in order for them to straighten their teeth. And I refuse to do it. I refuse. I absolutely refuse. So, if you're in that category, then get your teeth straightened. All right. So now, what teeth cannot get veneered? I mean, that's kind of the same question, but I mean, the ultimate one is really hypomineralized teeth. So if you have teeth that you're born with teeth that don't have enough enamel, that's one of the ones. Teeth that cannot get veneered are ones also, the ones that I just ranted on, are the ones that are not straight. Do celebrities get veneers or crowns? Now, the majority of them have straight teeth because they've gone through ortho. Okay, so like for instance, Justin Bieber, he's done Invisalign. Who else can I think of? I've done a presentation like this before where I've shown different kinds of celebrities. There are a lot of celebrities. What's his name? Tom Cruise. Tom Cruise has had braces and veneers braces, Invisalign, and veneers, and I believe implant. Don't quote me on this, but a lot of celebrities have had, they straighten their teeth first, whether it's through Invisalign or whether it's through braces. More than likely, it's through Invisalign. Just because they have to perform and they have to look good and stuff. They don't want that brace face. But yes, the majority of celebrities that you see, their teeth are incredible, they're gorgeous. More than likely, they've done veneers. For instance, Miley Cyrus, veneers. A lot of people actually have done veneers. Okay. All right. What happens if you don't want veneers anymore? Well, I mean, I put that picture because if you have put veneers on and you don't want them anymore, then you're not in a good situation because that's what I'm saying. I'm saying that's why you should not start until you know for sure that you want veneers, because once you put veneers on, that's it. Now, I've actually had a patient who came in not too long ago, actually, and she said, I want the veneers off and I want composite. And I refused to do it. I said, no way. I said, I'm not touching it because the veneer that you have on, there's no way that a composite veneer or a bonding is going to look even close to how this one looks. So once you have veneers on, that's it. It's a commitment. So that's why I put that kissing, because that's it. That's all you can, you just give them a kiss, right? I mean, not me, but like you give them a kiss. All right. Now, why do veneers always look so big? Now, they don't. Veneers are not supposed to look big. As a matter of fact, veneers are supposed to make you look better. They're not supposed to make you look worse. Now, the only thing that I can say is they were poorly planned. Okay, so if a veneer looks big, it's more than likely because a patient pressured the dentist into telling the dentist, I don't want you to remove much tooth structure, but I still want veneers, right? And the dentist trying to help this patient and saying, okay, I'll do it. But in hindsight, thought, okay, well, look, like I have to remove a lot more tooth structure so that the teeth don't look big. They don't look bulky. Because if you don't remove tooth structure, it's gonna look really bad. It's going to look like you have something on top of your teeth. Nasty. That's all I can describe it. Nasty. Okay. So that's why when you come in to Spinetti Dentistry and you get a consultation, I go through an intensive planning session and I make sure that you understand what it involves because you have to be on the same page as me. There's no sense in you starting this whole procedure, this whole journey, without you actually being on the same page, without you actually understanding what you're getting yourself into. Now, with proper planning, as you saw the befores and afters, they look gorgeous, like magnificent. They change a person's face, right? And that's why I'm saying the best investment you can make, if you had to make an investment in yourself, is veneers. Because once your teeth look absolutely gorgeous, you start like your energy becomes different, right? Every time you look at yourself is different. Every time you take a selfie is different. Every time you make a video is different, right? So that's what it is. So if you've seen people with bulky veneers, or if you notice that people have veneers, it's one of two situations. Either one, they were poorly planned, or two, the person asked for veneers that look fake. Okay. All right. Well, that's it. Thank you so much for tuning in. If you're looking for veneers, do not be shy. Email me. That's my email on the screen. You can email me directly and I'll guide you through the whole process. And me and my manager will guide you through the whole process. And if you're not ready, you're not ready. I'm not going to push you into doing anything that you're not actually ready. You're not ready to do. But if you have any questions at all, feel free to message me. That's my email. I reply to them. I get them directly. I'll reply to them as soon as possible. Hope you enjoyed this one. I hope it clarified any of your questions. If you have more questions and that I didn't answer, again, feel free to email me. I am very responsive. Have yourself a great night. And as always, keep smiling.